Good evening, everyone. You're so welcome to the University of Warwick MSc in Diabetes Care webinar and information briefing. We're so delighted to have so many of you on this evening and appreciate that you're taking time out of your very busy schedule to be with us here this evening. So the running order for today is that the first section of this webinar will be Mr. Diarmuid Brannock, who is our Director of Academic Affairs. He'll be talking to Dr. Madhumita Sen, who is one of our existing students on the programme. Madhumita has very kindly said she would join us here today just to give you an overview of what it's like to be a participant on the programme and her own personal experiences, because nothing is more valuable than to hear from an existing clinician and doctor on the programme and to see how they got on, if they're enjoying it, the pain points, and just to hear the reality of what they went through. And then we will have the programmatic overview from Mr. Diarmuid Brannock. And then Dr. Lecheman, who is one of our very senior academics and tutors in Malaysia, will be joining us to give us really an overview of diabetes care from a local context in Malaysia, what to expect on the programme as well. So without any further delay, I'm going to hand you over to Diarmuid to have a chat with Madhumita to begin with.
Brilliant. Thanks a million, Rebecca, and lovely to see so many people here this evening. We had our first intake onto the program from Malaysia in 2017, and it's gone brilliantly since then. We have a fantastic relationship and partnership with the Malaysian Medical Association, and pre-COVID was always delighted to get down to Kuala Lumpur and Penang to actually meet people. But that's been a while. Joined this evening by Madhumita, who is on the programme, and it's always fantastic to get the real life experience of somebody that's going through a programme that you're contemplating joining. So Madhumita, great to see you again. Do you want to introduce yourself to everybody? Give a little bit about your background.
Hi, I'm actually attached to a university in Kuala Lumpur, and I'm teaching and I do part-time clinic work, and yeah, I decided to join this, and I think our batch was the lucky one which actually met our
we met the first time, yeah,
face to face. Yeah, for a short while we were actually able to meet all our colleagues, and we made up this WhatsApp group, which was nice, but subsequently, as you know, yeah, that was the first and last time we met, unfortunately, but yeah, we've been keeping it going. So it was nice that we were able to meet first time.
Yeah, it really was. And Madhumita, you're an academic and a clinician. What made you decide that you wanted to take a deep dive into the world of diabetes and just, get to know more about diabetes?
Well, I mean, the thing is that knowledge keeps moving so fast, it's hard to keep up. And I felt that if I enter a sort of structured program rather than read bits and pieces, what happens when we are working is like the lectures I made 5 years ago, I'm just carrying on with those. I do read, I'll read Medscape articles and I'll put in a little bit. And so I thought when I heard about this program, I said, this is a great way. I mean, we see so many diabetes patients in Malaysia, right? I mean, all of you know that. So I thought it's a great way to update myself and, of course, get myself a degree in the process.
And how did you find? I think what you're saying is very similar to lots of people that they kind of keep themselves as up to date as they can, but the change in guidance on diabetes treatments even over the last 2 or 3 years has been phenomenal. The 2019 ADA and EASD consensus statement, the actual implementation of what's come out of the cardiovascular risk trials. 6 months seems like a long time in diabetes care in terms of changing treatment, and you are right, bring yourself through that in a structured way that you're as well as getting a degree from it, that you're doing that with the guidance of a group of international tutors. But how did you find actually balancing work and study and personal and family life and all of that? How did you find adjusting back to being a student, being a participant on a program?
Took me about 6 months because in the beginning I was really snowed under. I was sort of wondering how I'm going to cope. But you get into it, and actually the lecturers literally spoon-fed us to a great degree. I mean, the first few assignments was a bit tough.
Yeah.
Getting back into writing assignments and reading up, referencing, and all that was a bit.
Absolutely, and I think
It takes getting used to.
Yeah, and what we see all the time is the standard of someone's module 5 or module 6 essay, and you then go back and compare it to their module 1 or 2 essay. There's an entire journey that people go on, and I think that's incredibly normal. That as well as my view of this program is that as well as diabetes, you're getting you're getting a very transferable skill of critiquing and appraising literature, and learning how to kind of look at, well, what are the biases, or what are the what's potentially influencing a piece of work. But yeah, that it absolutely takes a little time to kind of get your head around that. And I think the other piece that you mentioned on time management, I think, is really important, that people try to put a little structure on it, so that if it is I'll dedicate a Tuesday evening or a Saturday morning or whatever it might be, that I think the sooner people can kind of find a rhythm and get to know what the kind of anticipated or expected input level is, it tends to go as smoothly as it can once that's there. But in terms of the content, I mean, as you say, Malaysia has a significant amount of diabetes. How have you found the content in terms of relevance to your kind of professional practice?
Well, the theory bits, of course, it was updating myself. What I really liked about this program is it made us look not just at the theory of how to treat diabetes, but there was a lot about patient communication, a lot about trying to understand patient problems and how to approach the day-to-day issues, which we don't bother much with actually until I did this course. Things like diet, how much exercise they should be doing, and how we can approach and explain to them how to go about doing that.
It's so sensitive. It's so sensitive. And if you're absolutely right. If you can get those basics of lifestyle and diet and exercise, if you can get the patient moving on those, then the therapeutics, the drug treatments, you'll be on a different path, and ultimately one with far better outcomes. So that those concepts of understanding how to approach sensitive issues with your patient, and why they're likely to resist change, and how you can empower them and coach them, that you're right, that is it's a really, really important part of the program. And how did you find I suppose, has it changed your professional practice? Has it changed how you approach your patients?
I'm definitely, I'm more confident about how I talk to them. I feel more at ease raising issues, which I used to sort of skip over before. And and I look into personal issues of the patient now, which I didn't really. Plus, another thing is, it did get me a lot up to date. So things like drug interactions and all, which we tend to forget. So it was good because it made me read more and understand better. So yes, it's made a lot of difference.
And what, I suppose, if someone was contemplating coming onto the program, what guidance would you give them at the outset to kind of help adjust to being on a master's program?
Well, I think in the beginning, like the problem I faced is that I didn't know how much work I would need to put in. It's like, because I'm in academics and I read on a regular basis, I thought, well, yeah, I'll manage. But it wasn't that simple, because to find the time to complete the assignments, and which meant that I was reading a lot more, because we get used to dealing with MBBS students, like, I'm
Yeah.
teaching undergrad level, so it was, that level is much easier. So here we are dealing with postgrad stuff. So it was something which I needed to get used to. Like I said, it took me about 6 months, but once I was in the rhythm of things, it gets easier. Certainly,
Yeah.
it gets easier with time.
Brilliant. No, absolutely. And I think, when we one of the things I'll show later on is that when we go and ask people 3 years after they qualify, what have they kind of taken away from the program, that research piece is really high. It's kind of patient care, kind of respect with your colleagues, and research is actually, they're kind of the three big takeaways from it. But Madam Ita, look, I could stay chatting with you all evening about this, but I'm conscious of everyone's time. Rebecca's going to be giving out to me to move on soon. Look, it is fantastic to see you. Really hope the project is going well. Madam Ita is she's at the professional project stage of the master, so she's deep in her research project, and yeah, almost at the finish line. So thank you so much for seeing us this evening.
Thank you.
Cheers.
Nice meeting all
Thank
of
you
you.
so much, Madam Ita.
Pleasure.
Take care.
Take care.
Dr. Lecheman, can you hear us okay? Are you?
Hi.
Hi, Lech. How are you? We can hear you. Oh, there you is your camera coming on?
Yep. Oh,
hey,
hi.
there you are. Brilliant. How are you?
I'm good. And how are you all?
Excellent. No, delighted to have you here again. So Dr. Lecheman is one of our key academics on the program. He is based in Malaysia. And are you going to give a chat first, Dr. Lecheman, or would you like me to do the presentation first? Which order would you prefer?
I'll just give a small chat. Yeah.
Brilliant. The floor is yours.
Oh, thank you. Hi, everyone. Good to see you all this evening. Just wanted to give you my thoughts on this program. I came onto it about, I think, 2 to 3 years ago. Well, the fact is, we'll all agree that diabetes is, the rate is ever going up in our country, and now 1 in 5 of adults have diabetes. We are, in terms of trying to do the minimum, I think all of us do. We take the BP of the patient, we take the glucose monitoring, but the fact is the complications are also hitting us and the patients. And we know that if you're on the course, you will also come across all these studies to show that if you intervene early, then you make a big difference. But the other thing I would like to highlight is, at whatever point in time a patient comes with you with a problem, diabetic patients, even if he has a big ulcer on his foot, there are things that you will learn to minimize his suffering, minimize the progression to a worse state. So one thing I've learned over the years is that at no stage do you need to give up on a patient. There's always something that you can do. And one way is to get armed with, the latest update, and also to have the knowledge and skills to do the needful. And this is one platform that you can learn that. And the good thing about this is you meet people who are also have noticed that you need to do something about diabetes, not only in your own locality, but across the country and perhaps even in different countries. And you get ideas on how things are managed all over. One of the things that you will also learn on this program is the chronic care model. And among the 6 features there, one of it is to keep ourselves up to date. And that's what you are here for. And the Zoom platform makes it ideal because you are interacting with people across the world in your own home. And that makes it ideal even in this COVID pandemic. One of the other things I feel strongly about is we always say the word multidisciplinary approach to a patient. But, you know, if you have many doctors taking care of a patient, the outcome won't be good unless there's one person who takes the lead. And I feel in diabetes, the general practitioner is best placed to take the lead in terms of planning at every point what to do next. So I feel GPs, general practitioners in our country can make a big difference to the care. In the past, it was just metformin, glibenclamide, and insulin. But now there are 8 or 9 different categories of drugs, and there's so much to know and be aware. I'll end there. If there's any questions, I'll be happy to answer.
I think one of the things you touched on there, I think you're right, Dr. Lecheman, that the role of the primary care family physician at the heart of managing the patient with diabetes is key. And one of the things that Madam Isha was saying is, you know, so much of that is around kind of communication and consultation skills and knowing how to nudge your patient in the direction you'd like them to go.
Yeah.
You know, if it strikes me that if you take purely a kind of, if all you're doing is kind of looking at someone's level, which they fail to hit the target that you'd like, and intensifying the medication, the relationship with that patient tends to be one of a progressive failure. And that, I think one of the things that we go to a lot of trouble in the course is to try to reframe how you have your relationship with your patients with diabetes, to try to empower them more, to enable them to succeed better. And they may end up on the same medication, but psychologically they might be in a far better place. And I think I'd be interested in your thoughts on kind of how
that's so very true. I have the benefit of being a doctor for a long time and taking care of patients. And I have patients who may not do very well on, let's say, getting their glucose down.
Yeah.
But I still pay attention to the other parameters that are important in that patient. And getting that to some extent to target also helps the patient. I have patients who have been with me for a long time with high sugars, but again, in terms of complications, they're not so bad because other things are taken care. In other words, every patient is different.
Yeah.
There's no reason to feel that you must get everything done with the same drugs for every patient.
Yeah.
Because they are different, you need to have a variety of therapeutic options for the patient in front of you who comes with a particular problem. If you have that knowledge and the skill, you can do better for most patients.
And I couldn't agree more. And that's a huge part of how this program is taught, is a very case-based, patient-centered approach, and understanding the nuances that, if Joshua presents and I present with slightly differing symptoms and conditions and levels, actually your approach and attitudes, that your approach will be different. And that it's tailoring that approach to the individual. And then, the family doctor being, at the heart of a wider team. One of the things I'm always conscious of in this program, and I think it's a huge benefit of the program, is that, the learners on this program will be with an international group. So there'll be people in Malaysia, there'll be people from other parts of Asia Pacific, and into the Middle East, in the same group. And there are different kind of referral pathways, there are different scopes of practice, and I think learning what colleagues do in other countries is really important. But one of the things that's always struck me about the Malaysian population of doctors on this program is the I suppose the time pressure that they're under in dealing with patients and the communication pathways into secondary and tertiary care. And I think that goes back to your point of they need to be kind of in the driving seat at the heart of it.
Yeah, yeah. I honestly think so. One other thing Ahmed, I'd like to highlight is one of the features of this is there's a weekly session where everyone comes on Zoom and you discuss the topic for the week. So you've had a chance to read the theory part of it online, and there may be some cases put forward, or you can even put your own case, and that is discussed. I think that's one huge good way to learn and to experience. Yeah.
Absolutely. And I think, when it comes to the assessment on this program, about 30% of the marks go for what Warwick called the demonstration of knowledge. And, we expect that any clinician can kind of, take a piece of text or research and read it. 50% of the marks go for the application. It's right. Can you now apply this in a real life patient scenario? Or, can you think about practical ways like patient registries of simply, using very easy, accessible tools to improve kind of the population that you have? So I think you're right. I think it is absolutely focusing on how can we apply this in helping patients, not, I suppose what the course doesn't go into in the same amount of depth is kind of, we're going to go into the bowels of pathophysiology of macrovascular complications. We'll do it, but we'll very quickly get into, right, Joshua arrives in your clinic and these are his levels. What do we do next? I'm giving poor Joshua a hard time this evening.
And one more thing, I mean, it is not as though you finish the course and then you start doing what you've learned. In this course, you learn and you apply this same time. Yeah.
It is absolutely immediate. I think, by the time somebody is kind of 8 weeks in, they're usually telling us that they're changing how they practice, which for me is an absolutely phenomenal endorsement of, yes, the program is grounded in scientific evidence, but actually the focus of it is, can you go and give better patient care? And, that's why people became healthcare professionals. That's at the heart of it, is can you give better care at the end of this? So look, again, I'm looking at the clock here and I'd better crack on into the presentation. Dr. Lecheman, fantastic to see you again.
Thank you. Thank you.
Can't wait till I can get on a flight to Kuala Lumpur.
See you guys. Bye.
See you later.
Bye.
Thanks so much. So what I'm going to do for the remainder of the talk now is I will give an overview of the program, of the structure of it, the kind of what it means to be a learner on this program, what it feels like to be a participant. So if you bear with me 1 second, I will share screen here, which hopefully you can now all see my screen. So one of the things you're going to, a couple of things you'll notice about this program from the outset. One is we are delivering this in Malaysia in collaboration and partnership with the Malaysia Medical Association. And that has enabled us, we'll get to this right at the end, but that has enabled us to give a very significant fee discount to people in Malaysia, which we are delighted with. And as I said at the outset, this program, this is now the 8th or 9th intake in Malaysia onto the program. It's been a fantastic success, and we're absolutely delighted with it. The other thing you'll notice about the program is you'll see Warwick and you will see iHeat interchangeably used in the language about the program. So iHeat is an Irish company set up by a family doctor in about 2013. We are a division of the Cambridge Education Group in the UK. Effectively, what we do is we are specialists in online medical education. So we have everything from master's programs such as this one with the University of Warwick, to family medicine residency programs like the MINT FM program in Malaysia that we run with RUMC in Penang and with the Irish College of General Practitioners and the Ministry of Health in Malaysia. And then, so family medicine programs, master's programs, and then shorter kind of CME programs as well, particularly across the Middle East. So we've had over 400,000 course completions to date since we started. So very proud of what we do, which is effectively enabling really prestigious institutions like the University of Warwick or the Royal College of Physicians to deliver their qualifications to an international audience on an absolutely amazing online learning environment. So that's iHeat. The University of Warwick, they need little introduction. They are ranked 8th in the United Kingdom. They're ranked 62nd in the world. So, they are up there with the very best universities in the world. In the UK, they're a member of the Russell Group, which is the top research-orientated universities in the UK. So their research output is phenomenal, and they are, they're absolutely thought leaders in diabetes and endocrinology. Looking more towards Asia Pacific, Warwick has a strategic partnership with Monash University in Australia, who of course have a branch campus in Malaysia as well, and Dr. Lecheman, as well as being a hospital-based clinician, is involved with Monash. So, there's it's a close family. Warwick in diabetes over the past 2 decades, they've got 14,000 diabetes graduates. In Europe, when you think of diabetes education, you think of Warwick. They're absolute world leaders in it. And so this program is, I think what is important coming onto this program is it is not distinguished in any way as being different from an on-campus program in Warwick. So the QAA, which is the UK Higher Education Framework, this is accredited as a master's level program, the exact same as if you studied on campus in the UK. It mentions nothing, your certification mentions nothing about online learning. It mentions nothing about being a distance type program or part-time, or doesn't mention iHeat. It is simply a University of Warwick master's degree that you exit with. So, it's a phenomenal award. And as I say, we're delighted to be able to work with Warwick to bring this to a very international audience. In terms of structure then, it's structured kind of in 2 parts. There's a 12-month postgraduate diploma, which is a taught program. And then there's what Madam Isha is currently on, which is a 10-month Master of Science module, where you do a professional project that I'll speak about in a few minutes. Obviously, I've spoken about the accreditation. It's a Warwick degree, the same as any other Warwick degree. It is recognised in Malaysia, and the MMA grant fairly generous CPD as well for the program. And there's a host of Malaysian alumni that are really benefiting from having done it. I think one of the advantages of the program is we have faculty like Dr. Lecheman from Malaysia, but you'll also get faculty from across the world. From Ralph Oudham is in the University of Melbourne, who's the president of the Primary Care Diabetes Association in Australia. Pam Brown here is, she's on the NICE guidelines committees for diabetes. We've got the National Diabetes Clinical Lead in Ireland. This is 4 of about 30 different faculty on the program, all of whom are equally as renowned in the field. So you get the benefit of a Warwick qualification, but also you get the benefit of a very international faculty and of being in an international and interprofessional group of students, which is a really, really important experience. So it's not like just doing a qualification in a local university, be that Ireland or the UK or Malaysia, where it's a very homogenous group. This is a very, very international interprofessional program. So in terms of coming on to a program like this, we structure it in small groups, and we keep the faculty to participant ratio fixed at that. So you'll have about 20 people in your group. You'll get to know that group exceptionally well. You get to know your tutors exceptionally well. The modules that I'm going to go through in a minute, the taught component of the program is structured into six-week modules. It's really well paced. The structure is flexible. And at this stage, we have years of experience of running it to see what works and what works well. I think what is important, and Madam Isha spoke to this at the start, is the program is manageable within your clinical or your academic workload. There's absolutely an adjustment time, and we expect everyone, the first module is very much kind of finding your feet and getting used to being a learner again. But it is, the program is designed as an online program. It's not a face-to-face offering that's been retrofitted to be given online. Its very DNA is an online program, and it is designed that everyone is a part-time learner and a full-time professional. And then there's huge support underpinning that. So the program management team are a group of educationalists that kind of guide everybody through the program. The tutors are an amazingly well versed in diabetes for one, but they're passionate educators, and they get very invested in their students and in their groups. So coming onto it, it feels like you're on a small group program, and that's something we're really keen that we always maintain, which is why we limit the amount of spaces on the program. But what it then gives you is all the benefits of small group teaching and really, really strong supports. So what the program actually covers, the first 2 semesters are taught modules, and each module is 6 weeks long. And as Lecheman said, there's a topic to each week. And for part-time learners, that's really important, that you can kind of compartmentalize and say, well, we're looking at diagnosis this week, and we're looking at we're looking at insulin the next in this week, or we're looking at physical activity, etc. So we very much follow the patient journey in diabetes. So we start off the core principles of diabetes, and this is really all about finding your patients and diagnosing them. So, how do screening programs work? What are the criteria for diagnosis and classification? And, really importantly, are there simple tools available to us, like diabetes registers, to keep track of our populations? And we give you an introduction to evidence-based medicine, which underpins the rest of the program, and shows that kind of everything we're looking at is evidence-based. We then go into self-management of diabetes, and again, this came up in our earlier conversation, that if you can influence your patient positively towards an improved diet and exercise, and an overall healthier lifestyle, their need for medication is significantly lessened. In extreme cases, they can put their diabetes into remission, and we know that from the direct study in the UK. But for most of us, it's about nudging our patients towards a better lifestyle and mitigating and reducing the impact of complications of diabetes. So what this module tries to do is give you a toolkit to draw from, and give you proven techniques of why people resist change and how to overcome that, and really, really practical things that you can bring into your clinical practice. We then go on to the treatment module, and we have taken an approach that this is an area that is advancing rapidly, and across all the different countries where we have participants on the program, there are different scopes of practice. So we teach you everything that there is currently available in terms of therapeutics on diabetes, whether or not it is within your scope of practice at the moment. Lecheman is preeminent endocrinologist in Malaysia, and worldwide there is a drive, as he spoke to have the family doctor at the heart of patient care. So he is one of many voices that feels more and more of ongoing diabetes management should be done in the community by family doctors and their wider teams. So whether or not you are prescribing GLP-1s now or SGLT2s now or not. We will teach you the full range of therapeutics that are available. We move into semester 2 then, and the second set of the 3 6-week modules, and we get into complications. So, small and large blood vessel complications. We look at, eyes, feet, kidneys, nerves, etc. And then we put a big focus on cardiovascular risk prevention in module 5. Module 6 then looks at, areas that don't neatly fall into any of the other modules, but are really, really important, like gestational diabetes. Like, what do you do if someone's fasting? What do you do if someone is, well, they're not likely at the moment to be traveling 6 or 7 hours east or west very often, but, what's the impact of kind of stressors in terms of sport, in terms of travel, in terms of, unusual events? There's such a well-established literature on the impact of diabetes on mental health and the links with depression. And it is very important as a clinician looking after people with diabetes that you are aware of that. We then look at diabetes in later life. And, people are living longer with diabetes, the therapeutics are better, we do interventions earlier, and that leads us to managing diabetes alongside other conditions associated with older age. So we very much across the taught modules, across the first 2 semesters, we very much follow your patient journey from, initial screening and diagnosis to helping them to manage their condition as best they can, into the various therapeutics that are available to us, and then managing the complications and the kind of the special circumstances people will find them in. We then, in semester 3, is where this moves from a course that, everyone follows the same path into you take your own specific journey. So you carry out a professional project in an area of diabetes that interests you. So we have had people do everything from looking at, the impact of SGLT2s on people when they are fasting. We've had people look at the impact of depression on diabetes. We've had people look at chronic kidney disease. It's any area of diabetes care that interests you. You do a professional project in that. And that project can be a review of the literature. It can be designing a huge research project that you would do after the master's. It could be to actually do a service evaluation in your own clinic or a quality improvement. There's a huge range of what you can do. The output of what Warwick have for this, though, I think is really important, that what you do isn't a 15,000 word thesis. It's a 4,000 word journal article. So again, it's very practical and very applied. We want to give you something, and our, one of our candidates from Malaysia is about to be published. They did a really interesting study on a particular drug that isn't widely used in the West, is used in China, and they did a review of that. And that work is going to be published, which is fantastic. The other piece that you do is a conference poster presentation. So you walk away from your master's with something that is absolutely tangible and useful for your career. So in terms of what this kind of looks and feels like on a weekly basis then, so the first thing we'll do is we'll give you a really good orientation into the program. So we have an induction week that in better times where we used to go into a hotel in Kuala Lumpur and see everyone face to face. We now have it as an online induction. It's working fabulously. And we'll get you comfortable with the program, all of the kind of supports that are available, the regulations, the assessments, and really get you comfortable with everything, including using the online learning environment before you start actually week 1. Each week then kind of follows a pattern where you'll have a weekly discussion forum. So you'll have a case topic that you will discuss, and that could be a patient presenting with background retinopathy, or whatever it might be linked to that week's topic, and you go through that case online in your own time throughout the week. The heart of the program, though, really is the online content, and you go through this each week at your own pace. So we've got amazing clinical content. It's full of really, really visual, interactive content. It's not, I suppose, what it's not is flat text. We're not asking you to go off and read, pages and pages of research. You can see here, this is, I've turned the audio off, but this is explaining how retinopathy forms, and the blood vessels need to go in single file and what happens when they don't. So it's a very, very engaging, really immersive experience. It's all, what we will do is we'll move very quickly from the theory or the background of something into patient cases and into, right, this person is presenting, what do you do next? And there's lots of interactive elements and little quizzes built into it, and it's really focusing on clinical decision making. As I said, it's got all of the depth that you will want, but it gives it to you in a really, really digestible, easy to follow way. So you go through the content for each week in your own time during that week. It's linked to the discussion, and then at the end of the week, you come together for the tutorial that Dr. Lecheman was speaking about. And, that's all about, well, how have I seen this in my professional practice? What does this look like? How do I deal with it? What are the challenges? And that can be anything from, either the doctor or the patient is hesitant about putting someone on injectables, or, how do we manage someone's foot care, gestational diabetes, whatever it might be. It's the practical application of it. So, you've got that pattern for each week of going through a discussion in your own time, the materials online in your own time, and then meeting your group. And, it's a small group to discuss everything. There's then, you do an essay at the end of each module. And that essay, again, is looking at how would you apply this? So the first essay talks about diabetes prevention strategies, and who would you put on a diabetes prevention strategy team and why, and how would you do this in your clinical setting? So how would this work for you? So it's, as Lech said, it's immediately looking for application. It's looking for, what can you do with this qualification? And then there's a knowledge-based exam at the end, which, again, really straightforward. The cases that we give you are patient vignettes. They're exactly like what you have in the discussion forum. And I think, the pass rates are extraordinarily high on this program. And that is down to the quality of tuition, the quality of people that we get on the program, and the assessment is fair. So when we look at some of the metrics on the program, we've put over 500 people in this program in the last 3 years, all in those small groups, which is so important to keep the quality high. I always look at this 88% student engagement statistic alongside the pass rate. And what it says to me is that the program is designed as an online program is working really well. Everybody is a full-time clinician. Most people on the program have young families, and yet, they're getting on average to 88% of what we're doing, which is phenomenal. And on foot of that, they're performing extraordinarily well. And the amount of distinctions that we have are really strong. The pass rates are really high, and that's a feature of really high quality caliber of candidates coming in, having a really positive experience, a fair assessment. You expect people to qualify at the end. The program support, there's hugely positive feedback on the program support all the time. So the other statistics, I suppose, that are worth looking at. We do pre and post surveys, and I think one of them, the green, is when people have finished the taught component of the program, which is, how comfortable are you in carrying out these activities related to diabetes care? And what I think is interesting is the ones which are kind of knowledge and application based of, I know how to prescribe for cardiovascular risk prevention. I know how to, dose adjust insulin, or I know how to intensify treatment, etc. they all go right up to 100%. People leave this program extraordinarily confident in those. I think it's quite natural that, you know, some of the ones around kind of lifestyle and obesity or recognizing emotional distress, they're more challenging. So again, you know, you'd expect to see those slightly lower. They're a fuzzier problem to overcome. But when we also look then at, you know, what are our alumni saying? And this is what I was speaking about at the start. What are they saying 3 years afterwards? So, you know, quality of patient care of patients with diabetes goes through the roof. And that is why we conceived of this program. Is we want to empower clinicians to deliver better care in diabetes and do that at a very large scale and have actual impact. Career benefits are great. You know, people are saying, look, there is positive impact on my career having done this. We've had people that are now sitting on national diabetes strategy committees, that they're managing specialist diabetes clinics. You know, they're very much seen, and it goes in with this point, they're very much seen as the go-to person in diabetes in their area. And they tend to liaise a lot more with the endocrinologist. They tend to get a lot more referrals. You know, that it just, there's a kind of halo effect of your reputation in diabetes care is strengthened massively by the program. And then the very transferable skill of, you know, the broader understanding of research and clinical trials and being able to interpret and analyze, and that goes across any discipline. Similarly, you know, the principles that we are speaking about in this program of kind of chronic disease management, they are as relevant to someone with COPD as they are to diabetes. So there's an amount of kind of transferable skills that all have positive career benefits and patient care benefits. I've kind of gone through that. So what is important in terms of entry requirements onto the program? So what we'll look for is, first, you know, evidence of proficiency in the English language. The program is done through the medium of English. And, you know, it's important that people are comfortable with that. However, it is not, we are not looking for something like an IELTS exam or an English language test. What we'll ask you for is a 500-word personal statement. And you will be having conversations with our education advisors throughout the admissions process. You know, that gives us the comfort that we need, that you will be able to complete the program through English. And, you know, English, the standard of English in Malaysia is phenomenally high anyway. You do need to have clinical experience in diabetes. You need to be seeing patients throughout the program. As I said, you know, it's a very applied program. It's very focused on patient management. So it is important that you can put that into context. You know, if someone's on a career break or on maternity leave, that's fine. Just come and talk to us. It's usually absolutely fine, but we do need you to be able to have the experience to know how to apply what you're learning. The base kind of requirements then is that you have a health science degree, and that can be medicine, nursing, and dietetics, nutrition. It can be anything that is related to the care of patients living with diabetes. And what we'll ask you for then is a copy of your degree, the personal statements, just a letter from an employer or an academic just to say that you're a healthcare professional in good standing, and photo ID. So it's a really, really straightforward process. And obviously it is not starting in March. It's starting this autumn. So, but in terms of what we'll look for as part of the application, it is, you know, we'll look for your degree, we'll ask you for the personal statement, and we'll ask you for your photo ID and the reference letter. The important piece, fees. This program benefits from a really, really substantial bursary, and that's thanks to the partnership with the Malaysian Medical Association. You can do the master's qualification for £9,000. You can do the postgraduate diploma only for £5,000. There are further reductions if you register early and pay early, and they are up against a deadline. I suppose they're there to incentivize early registration by the end of the month. But these fees, even without those further reductions, are massively reduced on how this program is offered internationally. When you pay your fees, there are loads of options around. You can pay by month, you can pay by semester. There's really, really flexible payment options. And again, the education advisors that you're speaking to about the program, they'll guide you through all of that. But I think the guidance I would give is, obviously, if you want what again is another fairly substantial discount on the program, then early registration definitely benefits you. The program, this program fills up every time we run it. The next intake is the 24th of October. That class size and that small group ratio is really, really important. It's what makes the program such a success. So it's offered on a first come, first served basis. So if you are interested, applying early and getting the benefit of the further discounts is, really advisable. The award from Warwick, that kind of goes without saying. A top 10 UK university that's, ranked where they are worldwide. It's phenomenal on your CV, and to be able to do that, from Putrajaya or from Penang or wherever you are in Malaysia, we're so proud to be able to bring that qualification and that prestige of an award to an international audience. It is part-time. It is designed around everybody being a part-time learner and a full-time clinician. What never comes across on these webinars is actually just how much fun it is. Like, you're with a group of 20 people. They all care deeply about diabetes. They're all really passionate about it. And it's a really, really enjoyable experience. You meet those people every week. You bring your cases, you bring your difficult, challenging examples to the group. You discuss it with your tutor, and you get very practical advice. So the benefits that we see from the program are enormous. It's there's obviously diabetes care, there's the wider piece of research skills, there's broader chronic disease management, there's also there's a huge piece of kind of international networking and opportunities. And again, we've had alumni from Malaysia that are now they're working in other countries, and this program was part of that. So it has a huge amount of benefits. But I'm going to pause the screen share now. I'm conscious I've been talking for a long time, and really happy to take whatever questions you might have. I think chat has been fairly quiet since we've gone through, but if there are things you'd like us to cover off or ask, if you want to put them into the chat, that would be fantastic.
Yeah, Sean has just reached out to me there, and he is a community pharmacist and asking if a community pharmacist is eligible for the program. And one of our highest performing Malaysian students ever is a community pharmacist, and he's exemplary, and he often does the student testimonials like Madamita did today. So absolutely, Sean, we welcome pharmacists. And an awful lot of our clinicians struggle hugely with module 3, which obviously is medicinal interventions. And that's where the community pharmacist will sail by, because you're so familiar, obviously, with all the new interventions, SGLT2s and GLP-1s, that you are ahead of the game in comparison to your fellow clinicians. So yes, we absolutely pharmacists.
There is about 6 or 7% of the intake every year is pharmacists, and there's a board of examiners meeting next Tuesday, and the top score from the master's program going before that board is from a Lebanese pharmacist. The Penang-based pharmacist that Rebecca referred to there a minute ago, he scored extraordinarily highly as well. Like, it is, it's very relevant to pharmacy, and pharmacists tend to do very, very well on the program. So as Rebecca said, you've got the pharmacology background as well as the kind of patient interaction background. So yeah, it's a great fit.
And we often talk about, I suppose, the doctor's interaction with the patient living with diabetes being perhaps 3 hours per annum, whereas the pharmacist interaction with the patient living with diabetes is far more regular in terms of prescription renewals. And from that perspective, in terms of really identifying issues with that particular patient and instigating interventions, you are really best placed in terms of being an instrumental part of the integrated care team to really help that individual. And this program will give you the additional tools to do just that.
Yeah, absolutely. So I think, you know, the program is, as Rebecca said, is designed for the interprofessional team around a patient living with diabetes. The majority of people that come on the program are doctors, and I don't think that's quite natural. But it's by being on a program that has other professions on it and has a range of nations represented as well. You know, you'll have people from Malaysia, from Singapore, from Australia, from Hong Kong, etc. You know, that it's a fantastic learning experience. It really is. Getting to see how things are done elsewhere is a brilliant learning. And you know, I think the other piece that comes across is the case studies are, you know, the content is contextualized for Malaysia. It's then contextualized differently for the Middle East and for Europe. So it's not just a kind of a Western UK qualification transplanted to Malaysia without thoughts as to the unique challenges of diabetes in Malaysia. Similarly, you know, when we deliver this in the Middle East, it's the same. You can't credibly talk about the same exercise and diet regime to somebody in London as somebody in Doha, as somebody in Kuala Lumpur. You know, all of those differences present different challenges to the clinician. So look, I'm conscious of time. The chat is still fairly quiet, but we have a team of education advisors that will be reaching out to you all. They will answer any questions that you have. We Malaysia has a special place in our hearts for running this program. Can't wait to get back there. Really hope to see lots of you on the program. And yeah, it's been fantastic seeing you this evening. So thank you so much for your time.
And just to let you know, you will receive a recording of this particular webinar and an email. In the recording, we'll also have the link to apply and the link to pay your deposit. And even though Dermot has already said this, there is a cap and the limit of places, and we oversubscribe for every intake. And we have a cap by time zone. So if you are interested in applying, I would encourage you to go ahead and proceed to deposit payment as soon as you can. But our education advisors will reach out to you by phone in the coming days just to have a chat with you and see if you need any assistance in progressing your application. So thank you for your time, guys. It's been a pleasure.
Thank you so much, everyone.
Take care, guys.
Cheers. Bye-bye.